PowerPoints. And UTIs are involving the upper or lower urinary tract. They can be uncomplicated or complicated depending on the patient's and the patient's condition or underlying conditions. So classifications can include lower UTIs or upper UTIs. Lower UTIs usually include the bladder, and upper UTIs usually include the kidneys. Uncomplicated are community acquired and are common in young women, but usually not recurrent. Complicated basically means it occurs in people with urologic abnormalities, recent catheterizations, and oftentimes are acquired during hospitalization. Signs and symptoms are similar for both: burning on your urination, frequency, nocturia, suprapubic or pelvic pain. That's most commonly seen in the lower UTIs, whereas you may have flank pain with anything involving the kidneys. You may have urgency, feeling that a patient would not be able to urinate but feels like they have to, would have to rush to excrete it. Also fever, especially in UTIs and the upper UTIs. It may have been less symptomatic, so they may be developing signs and symptoms of a fever, maybe sweating, maybe feeling lethargic and tired. So really we want to look at prevention, just preventing from urinary tract infections from occurring. And because we know E. coli is the most common bacteria, making sure that people are wiping from front to back, not back to front, dragging that bacteria into their urinary tract from their GI tract. Also avoiding bathtubs, bubble baths, or certain type of cleansing gels may increase their chances for developing UTIs. Making sure that they have proper fluid intake, especially older adults, making sure they're hydrated. Avoid any beverages like coffee, tea, caffeine, colas, alcohol, which either have high sugar content or can contribute to the environment for urinary tract infections. Voiding habit, make sure we're encouraging voiding. So unlike nurses who work 12-hour shifts and hold their urine, it's good to encourage people to go every 2 to 3 hours. And medications. So we want them taking medications as prescribed, but being aware of medications that may cause urinary tract retention, like anticholinergics, so they void before taking the next dose. And medications like if they're being treated for an infection, they need to complete the entire course of the antibiotic. So we don't want them stopping when they feel better, including UTIs. We want them completing that course of antibiotics so they don't end up with additional infections. Also, prevention is not wearing tight clothing, making sure it's breathable, making sure our older adults have regular kind of visits to the restroom. And again, hydration is really super key with older adults. With children, a key thing too is to realize that especially children who don't wipe very well, so oftentimes they're not going front to back. That's a common cause. Second, they may not be hydrating as well either, or drinking a lot of Coke or other products. In addition, like little children really like bubble baths, so it's important to realize if they do have chronic UTIs, they may need to stop with the bubble baths. And always do consider sexual abuse if a young child is coming in with multiple kind of urinary tract infections. It is something that we do need to consider. It is not the first cause, but it could be a cause. Complications, early recognition is really important. The most common cause of upper UTI infections is lower UTI infections. So if we happen to stop it before it travels up, that is a good thing. Renal failure, we need to recognize it and treat it before it leads to urosepsis or renal failure. Diagnostic findings are urine cultures. So these will be useful in identifying exactly what the bacteria, what exact bacteria is causing the infection. Usually we will start them on, if they have signs and symptoms, positive urine dip. We'll start them on an antibiotic and then wait for the cultures to come in. Please make sure that you get a urine sample before you start any IV antibiotics. Actually, any cultures before you start any IV antibiotics is very important. Also, something is an STD testing. Oftentimes you'll find that if they have a sexually transmitted disease, UTIs kind of go hand in hand with that. A CT scan can look for any polynephritis or abscesses that may be there, and then ultrasound. Nursing intervention, so relieve the pain. This could be just an antispasmodic, which is pyridium, which I'll talk about a little later in the videos, and you are responsible to know for your exam. Including pushing fluids, that's very important on these patients, frequent voiding, and getting rid of irritants for them. Discharge, education on personal hygiene, again, wiping from front to back, not back to front. Dragging that bacteria into our urinary tract system, cotton type clothing, so less of the synthetic tight clothing, but cotton so it's breathable. Increase their fluid intake. Make sure that they do adhere to the IV or the oral antibiotics if you're sending them home. It's important that they complete the entire course even if they're feeling well. And make sure that they stop the pyridium within 2 days because it can mask symptoms, which we'll talk about in a few minutes. Phenazopyridine is actually a medication. We know it pretty much by pyridium. You can buy this over the counter, and it actually works as a urinary tract analgesic. The interesting thing about this, they don't exactly know the mechanism of how it works, but it does work topically on the bladder. You should note that it shouldn't be used more than 2 days because what can happen is it actually helps with the signs and symptoms, the burning, the frequency, the irritation, with urinary tract infection signs and symptoms. But if you use it for more than 2 days, technically your antibiotics should be taking care of those signs and symptoms within 2 days. And if you keep using this, you won't be able to, or the patient will not be able to assess if the antibiotic is indeed working. So what you need to do is make sure the patients are not taking this more than 2 days. What can happen is they can actually, the antibiotic may not be working. This may mask the signs and symptoms of worsening disease process, and actually they can become very ill and sometimes septic. So again, 2 days maximum on the pyridium just to get them through those first stages of, burning and stinging and kind of the spasming of the bladder. So it is for symptom relief. This also, you need to tell your patient, will darken their urine. It sometimes turns it bright orange, bright red. It also will permanently stain their soft contact lenses. So actually it comes out in the tear ducts. It also will stain any of their new underwear, so they need to not wear their new Victoria's Secret underwear, or I don't know what male underwear there are. Their new Under Armour, very expensive underwear, because it will leave permanent staining that you cannot get out. So they also need to remove their soft contact lenses until they are no longer are taking the pyridium. They need to call the physician if they have more critical signs and symptoms of pale skin, fever, confusion, or yellowing of the eyes or skin. This is actually metabolized in the urine, or in the liver. So if they're having those signs and symptoms, it could indicate either a liver issue or a platelet issue. So These are contraindicated in patients if they have liver disease, diabetes, or something called G6PD deficiency, because then they can't break it down or metabolize it. It is a pregnancy category B. I do expect you to know pyridium for your exam, and just what we use it for, what you need to inform your patients about when they're taking it. Also, antibiotics with UTIs. So we identify exactly which bacteria is causing it, of course. The most common is E. coli. Common ones are Bactrim, Keflex, ceftriaxone. The fluorinocoins, actually like Cipro and Levaquin, we will use those with more serious infections, but they come with some really adverse reactions and warnings on their own. So we tend not to like to use those unless it's more serious. So we actually prefer Bactrim is usually the #1 treatment for a simple urinary tract infection.